Hello. Good morning to all of you. Here we meet again for a second part of my promotional webinar. The webinar is on complementary and alternative medicine, CAM in short, and energy healing. The first part, we have seen what is complementary and alternative medicine and how it is catching up with the conventional Western or English medicine. We stopped at that, the first part. Today, in the second part, we will continue the discussion on the complementary and alternative medicine. Hereafter, I may not use the full form. I will use the abbreviated form CAM. For the benefit of those who had not attended my first part of the presentation, I am introducing myself again as I am Kasturi Rangan. I am an engineer by profession. I have about 40 years of experience in the air conditioning, refrigeration and air conditioning field, that is HVAC field. I had been interested in the medical field right from my very young days, but circumstances prevented me from pursuing my interest. So I landed up with the engineering profession. Now continuing with the first part of my webinar, we were discussing some of the illnesses and problems most of the people face. Today, we start looking for solutions to the above problems and also other similar problems which were not listed in the first part of the webinar. As we discussed, our immediate solution, not only ours, anybody's, immediate reaction will be to resort to prevalent Western, as some call it, the English systems of medicine, being easier to access, being easier to administer. People tend to resort to Western system of medicine immediately. But rising awareness of the adverse effects of drugs and increasing interest in alternative treatment methods, because there are no side effects consequent to the alternative treatment methods, and since they are safer when compared to the Western medicines, the alternative treatment methods have resulted in being resorted to in catching up very fast in treatment of illness. Currently, the trending solutions with the CAM are complementary medicine, 2, alternative medicine, 3, energy healing. What is complementary medicine? It is that system which complements, which supplements, as the very name suggests, it complements, it supplements, it supports. It is used along, in conjunction with established conventional systems of medicine, the Western medicine. So, complementary medicine is not a standalone medicine. It is used in conjunction with other medical practices. Whereas, the other solution, the alternative medicines, they are standalone medicines. They replace and is used instead of the conventional medicines for treatment of certain illnesses and weaknesses. Used alone, I repeat, it is not used in conjunction with any other medicine. Third is the energy healing, wherein no medicines are involved. Only energy through exchange between two minds are involved in energy healing. No medication, no medicine. Only energy transfer between the mind of the healer and the mind of the patient. That is what is energy healing. Complementary and alternative medicines are being used nowadays as an alternative therapy practice to conventional medicines. Yes, that's why we are discussing it today. In the recent years, the market has witnessed a substantial growth in complementary and alternative medicine scam owing to the rising awareness of the bad adverse side effects of drugs and increasing interest because of the safe methods, because of no side effects in the alternative treatment methods like acupuncture, yoga, aromatherapy, Reiki, etc. Now, what is alternative medicine? Again, I am repeating what had been told in my first part, but still, it is worth it so that we remember it. We should not forget it. In general, alternative therapy refers to any health treatment which is not standard in Western conventional medical practice. What you have been following for throughout the years, for donkey's years, is a conventional Western medical practices. Whatever is not referred, whatever health treatment is not covered or referred in that list of health treatment according to the Western conventional medical practice can be termed, can be called as alternative therapy or alternative medicine. Then what is complementary medicine? When used alongside which standard conventional medical practices, alternative medicines are referred to as complementary medicines. As I said, it complements the already established practices. It is used along with complementary medicines. Alternative therapies, as I said, are mostly standalone therapies which are not normally combined with other conventional therapies. Examples are given later. Note that some people refer complementary therapy also as alternative therapy. Depending on the context, you should infer what they are meaning when they say this, what they are inferring. CAM, again the abbreviated form, is an umbrella term that encompasses a vast array of treatment options. The National Center for CAM, NCCAM, located in the United States of America, defines CAM as a group of diverse medical and healthcare systems, practices, and products that are not presently considered part of the conventional medicine. CAM therapies may work in a variety of ways. They may help to control symptoms, reduce symptoms, eliminate symptoms, and ease pain, enhance feelings of well-being and the quality of life, and will also boost the immune system of the patient. Now, when you are considering any therapy, it is important, needless to say, it is important to weigh, to consider the risk and benefits of that therapy. You cannot walk in blindfolded and accept any therapy offered by anybody. So you weigh the options, whether they are safe or not, see the risk involved, because less research has been conducted on the safety and effectiveness of CAM therapies. I cannot say, nobody can say they are foolproof, fail-safe. There are certain inherent deficiencies which may be overcome in the future. But as of date, CAM therapies are found to be very safe with no side effects. The efficacy of such CAM therapies only has to be established. So still research works are continuing and will take years, some more years, to conclude the results. It is recommended that anyone considering any of the CAM therapies or approaches should discuss them with their doctors and use CAM as a complement to prescribed medications already being taken by the patient. I do not recommend CAM therapies to be used as alternative to the other doctor recommended treatments. If a patient is already under a treatment, conventional treatment prescribed by a doctor, I do not recommend that CAM therapy be a replacement to that practice. Use a CAM therapy as a supplement, complement only. Because we never know what are the side effects involved. A complement therapy is not going to follow up with your present therapies, whereas an alternative therapy may not be safe when you stop the current practice and start off on the alternative practice. So to be safe, I recommend to use the CAM therapies as a complement therapy only and not as an alternative therapy unless and until the day we are cocksure that it is going to work as a replacement for the current therapy the patient is undergoing. However, despite my worry, doubts as above, CAM therapies are increasingly subjected to scientific trials. Nobody stopped it. The trials are continuing. The tests are continuing. And more information is becoming available to evaluate some of these therapies. So you please ask your physician or doctor or any CAM practitioner about any relevant research on the therapy you are undergoing or you are considering to adopt, about the safety and effectiveness of the particular practice. Don't just walk into the therapy room and say, I want to get treated. Do some research work. Of course, it is nothing so emergency. If it is an emergency, you will automatically resort to Western type of medicine. CAM therapies normally are not applied where emergencies, like a heart attack, is there. So when you have got time, do some research work, see the efficacy and the safety of the therapy you are likely to undergo, do some research work, satisfy yourself before implementing the program. Again, I am repeating, complementary medicine is different from the alternative medicine, whereas complementary medicine is used together, combined with conventional medicine. Alternative medicine is used in place of, instead of, conventional established practices or medicine. Now, all CAM modalities are divided into 5 broad categories, widely classified as: number 1, whole medical systems; number 2 is mind-body interventions; 3, biologically based treatments; 4, manipulative and body-based methods; and last, energy therapies. These are the broad 5 classifications which divides the CAM modalities. What is whole medical systems? Whole medical systems are complete systems of theory and practice that have evolved independently over time in different cultures and in different parts of the world. This development of the whole medical systems has been independent in, say, India, in Japan, or in US, independently developed. They are not connected with each other, or nobody has followed the practice. Indians have not followed the practice of Japan, or Japanese have not followed the practice in US. Independently over different cultures, these medical systems have been developed. The theory and practice both. They have been slowly evolved over the years. These whole medical systems include ancient, very ancient whole medical systems such as Ayurveda medicine and traditional Chinese medicine, TCM for short. Recently developed in the past few centuries are the modern whole medical systems called homeopathy and naturopathy. Second, we come to the mind-body medicine. Mind-body medicine is a set of interventions that focus on the interplay between emotion, mind, social, spiritual, and behavioral factors and their influence on health. Examples include prayers, hypnosis, meditation, biofeedback, and yoga. Some of these techniques in the mind-body medicine that were considered a scam in the past, like behavioral therapies, cognitive behavioral therapies, and patient group supports, are now offered as conventional therapies. They have moved from the list of scam. They were earlier included in the list of scam, but now they have found their place in the list of conventional therapies. So that means more and more people are accepting, adapting mind-body medicine as conventional therapies. Next, third, manipulative and body-based practices. Now, the very word manipulative and body-based suggests that it involves manipulation or movement of one or more parts of the body as a means of achieving health and healing. You cannot sit idle for this practice. You have to move. Not necessarily yourself. Somebody has to move also in some cases where you are unable to move yourself. Examples include chiropractic, which is a spinal alignment. You can say sports medicine involves a lot of chiropractic therapies. Massage, which all of you will be aware. Reflexology. Then Alexander technique, a technique used to correct the postures of standing, sitting, walking and all to reduce the bad effects of long-term usage. The craniofacial therapy and acupressure. Next is the energy medicine. Energy medicine is drawn on a number of traditions supporting the view that illness and diseases results from disturbances of subtle energies. Energy therapies are based on the use of energy fields of two types. One is biofield therapies. The biofield therapies affect energy fields that are allegedly surround and penetrate the body. These energy fields have not yet been scientifically measured, but it has been established that there is an energy field surrounding our bodies. You all would have heard about the term aura. What is aura? That is the energy surrounding a person's or even animals or even things. Everything in the world, universe, has got an aura surrounding it. Similarly, we human beings have got an aura, which is an indication of the energy surrounding our body. Depending on the strength of this aura, we can say whether the person is energetic, is radiating energy, where is deficient in energy. See, there are certain cameras available, recent developments, which can photograph these auras. Whoever is educated, equipped to study and study these visual aspects of this aura, can predict what is going wrong with a person should there be some problems. So that is biofield. Aura is a separate topic which we cannot discuss today. Biofield therapies involve the application of pressure or the placement of hands in or through these energy fields. Examples include Reiki, Qigong, and therapeutic touch. In addition to biofield therapies, you have bioelectromagnetic therapies. Bioelectromagnetic therapies utilize electromagnetic fields for the purpose of healing. Examples include magnetic therapy, sound energy therapy, and light therapy. Last, you have got biologically based practices. The use of substances found in nature, such as herbs, roots, foods, and vitamins, to strengthen, to heal, and balance the body, is considered biologically based practice. Examples include dietary supplements such as vitamins, probiotics and prebiotics, microbes and live bacteria used in foods, herbal products, fatty acids and amino acids, and functional foods. Incidentally, probiotics are beneficial bacteria. To put it in a nutshell, in a layman's language, not very detailed definition, but for our information, probiotics are beneficial bacteria, while prebiotics are food for these bacteria. Next, assume that you are convinced or you are already undergoing a CAM therapy. Question is, you might not have informed your doctor about it, yet you might be undergoing some Western type of medication with the doctor. You should not hide it as a secret. Should I tell my doctor I am using CAM therapies or I intend to do? Please don't hide it. Inform your doctor about any CAM treatment in any of the 4 or 5 domains described above earlier. You have been using or are considering using CAM therapy. Because even the most innocent looking vitamin supplement, according to you, it may be very, very minor, but the most simplest vitamin, the most cheapest vitamin you may be using might contain ingredients that could interact with your medication or with your other products. So you tell your doctor, don't hide anything. You don't know what is going to be the repercussions. But by hiding it, you may land yourself in problems. Now, unconventional therapies. What is unconventional therapies? The CAM therapies. Conventional therapies are the Western English therapies. So unconventional therapies can complement medical treatment and possibly help control symptoms, ease pain, increase the sense of well-being. Again, as I said earlier, many questions remain unanswered surrounding their safety and effectiveness in treating the diseases and the conditions they are supposed to treat. Hence, open discussion with your physician will give you ample opportunity to consider complementary therapies in an informed manner. You will go walk into the complementary therapy sessions, programs, well informed, knowing about the consequences, knowing about the procedures. Please walk into the therapy sessions with that knowledge. Don't go blindfolded. Not that you are going to question the practitioner. No. But to be sure about your own health, you have to be selfish. You cannot be blind to the consequences that can take place. So please learn about all these things, then only adapt CAM. You can use the following questions as a guide to discuss CAM with your healthcare team. Not that every practitioner will entertain such questions, but depending on the personal bond, the relationship you have with the practitioner or the doctor, he may answer 99% of the cases, he may answer you, unless you irritate him with the same question again and again. You can ask, Are there complementary and alternative therapies you as a doctor or practitioner would recommend for me? Wait for his answer. Know his answer. Note down his answer. Next question will irritate him. Have these methods been studied? Because he will feel without this knowledge, how will he recommend to you? Again, the question is redundant, but it can irritate him. Still, you can ask him, have these methods been studied? Next, what benefits I can expect from this therapy? Next, how will I know the therapy is working or not? Yes, there are no gauges like a thermometer or x-rays to know whether that therapy is working for you or not, except maybe the reduction in pain or the increase in the sense of well-being. There are no other practical apparatus to measure whether the therapy is working or not. It is only physical, mental being. If you are feeling better, yes, it is working. If the pain is reduced, yes, it is working. If the pain is increasing, yes, it is not working. So you are your own judge to know whether these therapies are working or not. The doctor cannot read your mind and predict it is working. You have to help him in assessing whether the therapy is working for you or not. That is why I said in the beginning, you should be very, very open. You should discuss with your doctor all the symptoms you are facing, all your feelings also sometimes. What is unimportant for you, what is insignificant for you, might be very, very important for the camp practitioner or the doctor. He will put 2 and 2 together and make 6 out of it. You might think it is insignificant, but for him it is all the more important that you tell him all your problems, all your symptoms, all the results, how you are feeling. Don't hide anything from your practitioner or the doctor. Take time. Now you will ask him, is there a risk that will interfere with my standard treatments? If he says yes, then you cannot resort to CAM. Are there potential side effects? What should I look out for? Normally, there are no side effects with CAM, but still to be sure, doubly sure, you ask this question. What should I look out for to know whether I am having any side effects or not? So you can also be on the lookout, whether I have nausea feeling, whether I have high temperature, whether I have got gasping problem, all these things, what are the potential side effects? Now you ask the doctor, do you offer this as part of your practice? Normally, Western medicine doctors, of late only, recently only, they have also started learning, applying CAM. Earlier years, no. So you can ask him safely, do you offer this as part of your practice? If not, then you ask him to refer you to a licensed practitioner in that area, whom this doctor may know, and who, because he knows that CAM practitioner, they may be able to exchange information far easily about you, about your condition, about your health. If they are strangers to each other, they may not discuss with each other about your problems. You will be a stranger to both of them. So preferably, if the doctor with whom you are undergoing a therapy already, and you are going to approach a CAM practitioner, it is preferable that both the person, both the doctor and the CAM practitioner know each other, or let it be the same person, so that your issues are discussed easily and better. Now, the next question is more important. Are there any specific CAM therapies you would advise against? That I should not undergo this, I should not have this, I should not have this CAM, I should not have that CAM. Please list out those which I should not undergo. That is more important. The CAM practitioner may unknowingly, inadvertently, without knowing your background, refer you to many, many treatments. like you can say physiotherapy. Only your current practitioner will know what are the points due to which you should not undergo physiotherapy. So such points are there to consider before you embark on CAM in addition to your existing medication. Now, beyond all that, what have been discussed before, complementary and alternative therapies are difficult to define, largely because the field is so vast and diverse. It is not a small field. It is very, very diverse. It is very, very large. It encompasses diet and exercise changes, hypnosis, chiropractic, adjustments, and acupuncture. What is acupuncture? You poke needles in a person's skin, among other treatments. All these are encompassed in the CAM therapies. To summarize, putting all things what we have been discussing into a nutshell, alternative medicine, that medicine which is not standard in the Western countries. Complementary medicine, that medicine which complements, supplements, and is used together with the standard medicine. The benefits of alternative therapies are again repeating hotly contested. It is not tested so far, so it is contested. It is not tested, I will not say that. It is not tested to the full extent. Here and there it has been tested, but not in the way people will readily accept it. So it is still being contested. More and more people are comfortable, however, in the application of these therapies. Why? Because largely there are no side effects, no dangers. So more and more people are comfortable and adapting to these alternative therapies. More research is needed to determine the efficacy of nearly all these practices, and that has not stopped people from checking them out. You can also check them out. Tick one by one. Yes, it is working for me. It is working for him, like that. Now, some examples of CAM practices. You know, there are hundreds and hundreds of CAM practices. It is very difficult to list all of them in one place. Okay, a book can help you, but definitely not in a webinar or a seminar or a meeting. You cannot list and explain or discuss all the CAM practices because there are hundreds and hundreds of them. It's not simple. Maybe some particular practice may excite you, may appeal to you, which you can explore further or discuss further with your doctor. Here what I have done is I listed some, all of which will never get discussed here in this webinar. Maybe in future when you are going to take up point by point, which is going to happen soon. It is only for information about the exhaustive nature of CAM practices available. So the list of alternative medicine practice, the list does not cover all the forms of therapies available, number one. Number two, as I said, not all that is listed will be discussed. The list is only for your information. I will not be able to read out all anyway for our benefit. I will read at least 2 or 3 slides. You can also note down if you want, starting with acupressure. It is listed alphabetically, acupressure, acupuncture. Then affirmative prayers. You know, every day you will be, most of you will be already saying affirmative prayers. It's a sort of a treatment. Then Alexander technique, as I already said, it is a technique to improve your sitting, standing, sleeping postures by which your pains are reduced. Aquatherapy, aromatherapy. Aromatherapy use the sense of warm boiling oils, the smell of which is supposed to cure you. Auricular therapy, autogenic training, autosuggestion. Autosuggestion is very interesting. Suppose you are to catch a plane, flight or train tomorrow early morning. say 6 o'clock. You have to be at the airport or the station by at least by 5 o'clock. I mean, 1 hour before. So 4 o'clock. That means you have to leave your house at least by 3 o'clock. That means you have to set your alarm by 2 o'clock, working backwards. You may tell your parents, you may tell your spouse, you may tell your children, please wake me up. You may set your alarm for 2 o'clock. Despite all that, you would have told to yourself unknowingly, I should wake up at 2 o'clock. I should wake up at 2 o'clock. At least about 5-6 times, you would have uttered this to yourself mentally, if not loudly. What have you done? You have suggested to your own subconscious something which you want to happen. And that is autosuggestion. Now, without anybody waking you up at 2 o'clock, there are chances, 90% of at least, that you will wake up automatically at 2 o'clock. Because your suggestion has automatically worked for you and you are up and awake at 2 o'clock. Now, not only for waking up from a sleep, these things work for so many other situations also. Like you want to quit smoking. You keep on suggesting to yourself the ill effects, the bad effects of smoking. One fine day, very soon, you may, I'm not saying you will, this autosuggestion will work. You may quit smoking. Similarly, you can suggest so many things. I should start exercising tomorrow. I should start exercising tomorrow. Like that, you keep on telling to yourself, you will end up doing exercising. Next is Ayurveda, such a vast topic, separate topic by itself. Then you got batch flower therapy, balneotherapy, all this. You can note down. I will give you 1 minute per slide instead of my reading it out aloud. You may note down if you are interested, and if any particular topic you find interesting or intriguing, you may inform me later, which we will discuss again separately, in detail. Okay? Now, the first in this list is chelation therapy, which is slowly trying to replace, I'm not saying it has been very, very successful, but many people have undergone this, is used to replace bypass surgery of the heart. You know, there is blockages of the arteries or veins, which is leading to heart attacks. That blocks are removed either by surgery or by medication. Mostly bypass surgeries and stents are used to remove or replace the blockages, the part. Chelation therapy, it uses some sort of vibration. The patient is subjected to a lot of vibrations, sometimes running into 6-7 weeks, that's about 50 days. The vibration causes the blockages to dislodge. It causes the blocks to disintegrate. The disintegrated particles pass into the bloodstream, and ultimately it gets rejected in the kidneys, where it is rejected along with the urine. It is expelled out. Some people who have undergone chelation therapy are claiming wonderful results. There is no danger of bypass. There is no danger involved. But the time, it takes about 50 days to complete the course. People are impatient. Whereas with a bypass surgery or a stent surgery, it will be over in a day or two. You are back to the pavilion. And chelation therapy is almost as equally expensive as the bypass surgery. So, because of less danger, people are resorting to chelation therapy. About this Chinese stuff, you would have been learning, reading, hearing, lot of stuff. So, no point in my elaborating on these Chinese methods of therapies. Then you come to the chakra. Like I was saying yesterday, I pronounce it, being a Malayali myself, inadvertently, I call it as chakras. We all learn CHAKRA is chakra. Whereas most of the camp practitioners abroad, even in India, I don't know, they pronounce it as chakras. Okay, whatever the meaning is, the intention is same, chakra or chakra. You know, our body is supposed to have 7 chakras, which are going to convey, distribute the energies within the body. The higher the spinning velocity of the chakras, the more energy is distributed. If the chakra spinning is reduced, you feel less energetic. Separate topic by itself. Chiropractic, as already told, it is alignment of the spinal cord. Then you have got chromotherapy, color therapy, colon cleansing, colon hydrotherapy. What is colon hydrotherapy? Is enema, which sometime or other many of us would have undergone to overcome constipation or to clean the stomach before a surgery. Then you have got crystal healing. Yes, people are resorting to crystal healing, very, very popular now. Crystals are supposed to vibrate, and they pass on this vibration energy to all the people surrounding nearby. So people are tending to keep crystals near their bed, under their bed, near their workplaces. You have got specific colors and shapes of crystals. Depending on the problems you are facing, these colors and shapes are recommended by the practitioners who are experienced to help you in these things. Then you have detoxification, which again is a topic all of you would have heard about, learned about. It detoxifies your body. Now, dowsing is a very, very interesting topic. You know, in the earlier days or even now, in water-starved areas, you want to know where to put your bore well, bore pump. Even in our apartment, I think they did it in the very, very beginning. Where to locate the pump, the bore well, so that I get water. You know, in some places within the same land, one spot will give you abundant water in the pump or in the well, whereas a spot which is hardly 20 feet away or 15 feet away from the spot, despite the depth of the well, you will not get any water. So there are water diviners, they are called water diviners, who use the dowsing methods to locate the point where if I dig, where if I put the pump or the bore well, I will get water. That is one aspect of dowsing. Then you have got pendulum dowsing, which helps you to locate lost objects, which helps you to predict the success of your ventures, which helps you to predict your health. All these things are becoming a vast topic by itself, dowsing. We can discuss it separately some other day. Then you have got electromagnetic therapy, electric medicine, electro-homeopathy. In addition to standard homeopathy, you have got electro-homeopathy also. Then your energy medicine, magnetic therapy, Reiki, therapeutic touch, energy psychology. Now the list goes on. Feng Shui, you all know, is the process of keeping certain pictures and materials or articles in your workplace or home, which will fend off negative energies and bring in positive energies. In effect, the end result is it will ensure your well-being financially, monetarily, and medically. Feng Shui is a vast topic by itself, like your Vastu. Vastu is one topic, and in addition to Vastu, people resort to Feng Shui also. Now the next interesting is homeopathy in this slide. It's a very, very, very vast topic. People are again willing to try homeopathy instead of Western medicine for a simple reason: there are no side effects or dangers involved. Maybe the curing time the healing time is protracted, is more with CAM, with homeopathy. What can take 2 days in a Western system of medicine will take maybe 2 weeks for the same curing with homeopathy. But people are willing to wait. Whereas they may be impatient with other things in their life, when it comes to their treatment of their illness and weakness and bodies, I think majority of the people are willing to wait because it concerns their health. I hope we all have the patience to wait for the treatment using CAM therapies. Home remedies, all of you will be keeping a big book which gives you guidance, tips for any kind of problems, right from snake bite to loose motion stomach problems, to sprains, to sleeplessness, to every damn thing you get remedies now, all compiled in one book, home remedies, hundreds of them. Then you got hypnotherapy, where the patient is subjected to hypnosis. Whatever is his feeling deep inside in his mind are brought out. The doctor, the hypnotherapist will come to know what is creating the problem for the patient, and then he will try to alleviate the reason, the causes, whereby the symptoms disappear by themselves. Then they have got magnetic healing, manual massage therapy, all that. There are hundreds of massage parlors. I don't know whether people are visiting massage parlors for the heck of it or for really to alleviate their pain. Not known. It has become sort of hypocritic, if you ask me, massage therapy. It is not. Visiting a massage parlor can be genuine if you are going there to have your pains reduced. But I don't think that's the only reason that people are visiting massage therapies nowadays. It's become like Hippocratic. And I visited this parlor yesterday, it was so nice. I don't know. It is left to the individual's feelings. Music therapy, most of the old people or even young people nowadays listen to music to reduce their tension, to reduce their stress. Again, you have got hundreds and hundreds of musics now. For each and every kind of problem, you have got certain music, which, YouTube is listing out. You want to increase your, one chakra energy, you listen to one particular type of music. Like that, you have got a list which music can help you. You listen to that music. Definitely, some of the music play throughout the night. There are musics to increase your financial income also. I don't know. That is too much. If it is health, I can imagine. But a music related to financial income, I am not personally for it. It has to be tested. Anything to do with your health may be possible with music therapy, but not what is extraneous to our body, extraneous to our health. Meridian, Chinese medicine, that is the acupuncture. Then mudras, the last. Certain positions of fingers and hands and palms, certain alignment of them for some period of time, say 5 minutes, 1 minute, 2 minutes, for 10 minutes a day, 15 minutes a day, repeated over a period of time. These mudras can alleviate, reduce, even cure some of the problems people are facing. Then you have got what mentioning here is neuro-linguistic programming. It's a very, very vast topic where your mind is treated by repeated suggestions or programs. You tend to get cured without any medication using NLP, which is neuro-linguistic programming. Not everybody is mastered to do that. There are practitioners who have mastered this NLP companies mostly employ this, not on an individual basis, but as group therapies. Then you got prayer, of course, all of you will be praying, I am praying. Then Qigong is another Chinese method. Reflexology, Reiki. Reiki is very interesting. When it comes to energy healing, Reiki uses distant healing methods. There is no medication involved, as I already told, in energy healing. The practitioner can sit in one place, the patient will be totally in another place. The practitioner, using his energy, establishes contact, connection with the patient, transfers energy, and the patient is likely to get cured. Also, in addition to that, Reiki will also do touch type Reiki, where the patient is touched here and there. The practitioner places his hands here and there at the required spots to cure the patient. And instead of administering medicine, the practitioner is only transferring energy, the universal energy, through him to the patient. Believe me, it is not the practitioner's energy that is getting transferred to the patient. In Reiki sessions, the practitioner is only a conduit. He transfers the universal energy through him to the patient. Because the practitioner is not a sink, he is not a vessel to hold energy and keep on passing to the patient. He is only a conduit, a channel for the transferring the abundant, unlimited, universal energy to the patients through him. Self-hypnosis is something similar to the autosuggestion, what I had mentioned earlier. Again, coming back to the massages, there are too many of them, not possible to discuss. It has to be experienced. Which one is better? Which one is suited for you? I cannot tell you go and have a Thai massage or a Korean massage, because what is working for me or what has worked for me may not work for you. So you have to experience each type of massage yourself and conclude which is going to work for you. Then yoga. The last I wanted to mention about camp. Yoga is again such a very, very vast topic. Yoga, I have myself listed about 10 or 12 yoga therapies, different types of yogas. You have to find from the yoga practitioners or your doctors which yoga is better for you. You cannot adapt all the listed yogas. Some may be suitable, some may be required. But go for the required ones first. Go for the possible ones. Don't attempt the impossible ones, because you will stand up spraining, breaking your body. Go slowly. Take the advice of the yoga practitioners. Okay. With this, we come to the conclusion of camp therapies. We have to start with energy healing, which I intend to do in my final third part of the promotional webinar or presentation. Hope to see you there soon. Thank you for being with me. Good luck and good day. Thank you.